Hi, everybody. We're going to start out today with Chapter 1. We're going to be talking about what is a licensed mental health or professional counselor. The learning outcomes, really, if you think about what we're doing here, we're basically trying to articulate a definition for clinical mental health counseling. So we're going to do that in a few different ways. One of them is going to be talking about the 2020 definition of counseling, talking about some of the key tenets of clinical mental health counseling, uh, talking about relevant professional organizations, differentiating clinical mental health counseling from other related helping professions, and then identifying and describing the stages of professional identity development. They had this slide in the beginning here, and I thought it was useful to leave because it's a metaphor, right? That basically becoming a professional counselor is like a personal journey by car. And one of the first things they want you to ask yourself is, where are you at now? Right? So just coming into school, I think that's a pretty good perspective to take, right? Even if you've been in for like a year or so, where are you at now is a starting point. The destination, where do you want to be? And along the way, there's going to be these other conditions. There's going to be the road quality, the weather quality, traffic. You could insert whatever you want for that part of the metaphor, but like maybe road quality is the quality of your experience in the program. Maybe weather quality is the socioeconomic events in the background. Maybe traffic is um, other people, being in the field. How does that affect the market? Unexpected events, rest stops, refueling, could literally be taking a rest or having to refuel your body, right? That self care, wellness that you'll be talking about throughout the program. Detours, maybe there's some other things that you're thinking about within counseling that you hadn't really quite thought of at first. And perhaps even getting lost to be like, do I want to counsel? We all get that imposter syndrome to a degree, and things come up. But I like this metaphor because there's also always a way to get back on track. And I think it's the same thing for our clients too, right? Sometimes there's going to be some type of metaphor that guides their life. So just starting this out, I think, and putting this on your radar, because think of this as a journey, right? There's longevity to it. So if you get caught at any one point, try to ask yourself what you need to get back on track, and if you were to, what the rest of that journey is going to be like. So, there's a lot of sources of professional identity confusion. Here we are talking about clinical mental health counseling. So, what does it really even mean to be a counselor? Well, first of all, there are varied uses of the term counselor or counseling, right? So, counsel generally stands for one person providing assistance to others in a particular manner. So, that's not really in and of itself going to help us figure out what a counselor is doing, right? So there's a lot of other helping professions, all of whom we would say counsel, like psychiatrists, psychologists, social workers, marriage and family therapists, psychiatric nurses, etc. And then even when it comes to licensure laws and the professional titles and the standards, different states have different laws about what's needed. So that can also be confusing because it's like, well, if one state allows a class for sexuality counseling, but another state doesn't require you to have that for your license, it's like, well, what are the roles and responsibilities and functions of a counselor? And I think the last thing, too, among many other things, is that there are numerous counseling specializations, all of who can be licensed as LPCs. So when you get down to this common denominator of LPC, and even if you're in addictions, if you're in school counseling, if you're in clinical mental health counseling, to think that you all can become LPCs kind of confuses it, because it's like, well, what does it mean then to be an LPC? So I could see if coming into the program, all these different things are confusing as to, all right, well, what is a clinical mental health counselor? And that's why we're here talking about this in Lecture 1. So just to clarify how the author talks about it in the book, licensed mental health professionals or professional counselors are licensed professionals. I bolded the ors, you could say, because when he talks about clinical mental health counselors or professional counseling, he's talking about the general professional identity. So clinical mental health counselors can be anybody, even if you're not licensed, right? Like as soon as you guys graduate, you'll be clinical mental health counselors. You'll be involved in professional counseling at that point. A licensed mental health professional or a professional counselor is a licensed professional. That's how your author's using it. I don't think it's going to be a big point, some type of hang up that we have to spend too much time on, But I do want you to keep that in mind because having a license is a significant, part of the profession. So, um, and we're going to talk a lot about things that pertain to licensure. So just keep that in mind. So we want to start then to increase the clarity. If those are sources of professional identity confusion, we want to talk about the 2020 definition of counseling, right? So the 2020 definition of counseling comes from this initiative, A Vision for the Future of Counseling, and it was a major effort within the counseling profession, right? So, the whole idea was to create a shared vision and unify professional identity for counselors. And this kind of spurred out of like the, development of many specialties, managing these differences across states that we're talking about in terms of licensure titles and professional definitions. You have organizations that we're going to talk more about, like the American Counseling Association, that was largely involved. And we also have the American Association of State Counseling Boards that was involved at this time around 2005. So, what kind of definition did they come up with? Well, a part of what fed into that was, what do all professional counselors have in common, right? Regardless of specialty. So now, once again, we're talking about LPCs, licensed professionals. You see that word professional counselors there. Professional identity. The unified profession has benefits, right? There's benefits to being a unitary whole. Maybe some of those things could even be like public perception, portability of counseling credentials, the research base that builds up when everybody identifies as one. Students and prospective students, right? What's their experience going to be like coming in if we're a unified profession versus if we have pockets of professionals doing different things? Promoting client welfare and advocating for populations. Yeah, I mean, we want to solidify our profession so that we know how to actually help and assist clients. So one of the basic definitions then that they kind of came up with is counseling is a professional relationship that empowers diverse individuals, families, and groups to accomplish mental health, wellness, education, and career goals. I feel like that's a really good snapshot, right? Like if you're asking yourself about the general definition of counseling, it's a professional relationship. It empowers diverse individuals, families, and groups. So those are kind of the milieu that we're working in, right? We're either working with the individual, the family, or the group. And then we accomplish mental health, wellness, education, and career goals. I like that because our profession comes out of that, right? And we're going to be talking about that throughout this group. Another place where you might hear a lot about that is also like career, since we have a lot of ties to career counseling. So the fact that they bring up mental health, wellness, education, and career goals, I think accurately talks about the outcomes and endpoints that we work with. So just some other helpful definitions, right? Like let's just expand upon this counseling definition because over time we are trying to clear up the identity confusion. We're trying to know who we are. So let's look at that from a couple different angles. So some helpful definitions. In 1997, the ACA Governing Council defined professional counseling as the application of mental health, psychological, or human development principles through cognitive, affective, behavioral, or systemic intervention strategies that address wellness, personal growth, or career development as well as pathology. So I broke that down, right? I bolded it, italicized, underlined, because I feel like when you look at those, they actually tell us something about counseling. So the first part, the application of mental health, psychological, or human development principles, that's what we study, right? That's kind of like our theoretical base. We look at, okay, what is mental health? What are general principles about psychology and human development that inform us what we should be doing in a counseling session, right? Then the italicized part is we do that through cognitive, affective, behavioral, or systemic interventions. So yeah, cognitive, like we use CBT, we talk with people about their thinking. Maybe an effective strategy, we work with doctors sometimes. Medication can alter kind of that affective state. Maybe we do some type of behavioral treatment where we ask somebody to go join a club, maybe try some relaxation, maybe a little bibliotherapy, read a book essentially. Or a systemic intervention, right? So that maybe we need to intervene at the level of the family because the family is actually reinforcing the problem. So our endpoints then are wellness, personal growth, career development, or pathology. So it's not the same as the last one, but you still get that same feel where it's like, okay, I'm helping people be well, I'm helping them to grow in some way. Maybe it's something with their career, and it could outright be mental illness. So I thought those were, that really covered the span of our education, our interventions, and our endpoints. And then some other, helpful definitions continued. In 1987, the AMHCA defined mental health counseling as mental health counseling is the provision of professional counseling services involving the application of principles of psychotherapy, human development, learning theory, group dynamics, and the etiology of mental illness and dysfunctional behavior to individuals, couples, families, and groups for the purposes of treating psychopathology and promoting optimal mental health. I bolded individuals, couples, families, and groups there once again. I mean, I know that when I started out in the field for the first time being a therapist, I ended up being an individual, a family, and a group therapist at once. So I think that's relevant because that is how we treat individuals. And when you become a licensed professional, you're going to figure out, like, who do you want to treat? Are there individuals that you do want to work with? I mean, maybe you really want to run groups or work with families, or you see particular interventions that could be relevant for one or the other, and you know that all of these domains make sense to work in. So I think just emphasizing that here, because that will be the way that you treat your clients, right, in those modes, either individual, family, etc. And then just here's the last one. Don't want to bore you to death with it. And in fact, I'll just point out the bolded one here. This one definition also includes prevention. So I think that is actually a big part of, I would say, definitely clinical mental health counseling and counseling in general, where we're also trying to prevent disorders if we can, right? I mean, if in talking with our clients, we're learning about what appears to have caused some of their problems, I mean, we certainly want to try to avoid those things. And if through research we're learning about meaningful antecedents to the development of mental disorder, we certainly want to prevent that and manage that early on, right? And then this other definition underneath what I have bolded is, it says diverse individuals, families, and groups. We also need to keep that multicultural component in mind. Also demographics change over time, so we should never assume that this one point in time, this one culture, that's all we need to know about, because things by definition are always going to change. So I think when you take all of those together, I think that it really captures what we do as counselors in general. And then we're going to speak a little bit more on clinical mental health down the line, and we're also going to define those organizations. I didn't really need to specify them all here because we were focused more on the definitions. So when it comes to other related mental health professions, then let's try to separate ourselves so that when we think of counselors, we can understand maybe why we're not a psychologist or we're not a psychiatrist, etc., right? So psychiatrists are physicians who specialize in diagnosing, treating, and preventing mental illness. To a degree, right? I'd say we do that. So that's maybe not super different from what we do. Now, they can prescribe medications. So that is a huge difference. We cannot prescribe medications. And they obviously go to medical school since they are medical doctors. So for us, the medication component is going to be pretty different. And when you're working with that, you're often going to be working alongside a psychiatrist, right? A psychologist, it's a doctorally trained professional who can assess, diagnose, and treat mental illness and emotional distress. Once again, pretty similar to us. They have the statutory right to diagnose and are highly trained in psychological testing. So one thing I do want to say, diagnosing can get a little bit sticky, I think, in different states. I'll have to check all of the rules. I know we can diagnose in PA, but just to be clear, that one could be a little bit contested. But certainly what psychologists can do that counselors have a little bit of a different role is in the psychological testing. And part of the way that you see that is in their training, right? So a lot of times they have classes on intellectual assessment. They also have classes on personality assessment. And once again, that's not to say that counselors aren't aware of those things or know how to interpret some of that information. Certainly, like personality, for example, can be utilized when we're studying career and trying to figure out, general things about our client and what that might say about some of their career outcomes. So, and I'm actually interested in studying some of that going forward as far as research. But the point here is that they do some more in-depth psychological testing, and that's why they often work in hospitals and things like that. Not to say that that's the only location, but it's a common place because those kinds of assessments are needed. That's supplemental information about some of the patients. So psychologists are doing some in-depth testing. As far as social workers, you know, I also don't want to limit these definitions, but like one thing you often hear is that they link people to tangible services, right? So they provide counseling, they help communities to improve health and social services. They advocate for the inclusion of social work principles and values in relevant legislative processes. I think one thing with social workers, for me, the way I've always remembered it is like um, sometimes their internship, they have a portion of it that can be a little bit more of an administrative role. That really does have to do more with that tangible services piece, connecting people with the community. In counseling, we're really more focused on the counseling aspect. That's not to say that we don't take a case manager function sometimes, depending on the setting that we work in. And we certainly want to know about different resources and services like that, but I feel like a social worker might even be a little bit more tied into those services, know people, know individuals at those services, and it's kind of easier to coordinate that process, as opposed to a counselor that's probably more focused on the therapy aspect. Then marriage and family therapists, they diagnose and treat a wide range of human conditions, including individual psychopathology, parent-child problems, marital distress and conflict, within the context of marriage and family systems. So, that's the big thing right there. It's in the marriage and family system often. So you'll get therapists like that do primarily work with families. Now, let's start to talk about the key themes. So we talked a little bit about some of those differences with the other uh, health professionals, but what key themes do we really associate with clinical mental health counseling, right? So, and also, I would say this still kind of it involves counseling in general, right? So there's an emphasis on wellness, strengths, resources, and competencies of the client. That's important. Once again, like we think sometimes of just like mental illness as the thing we're treating, and really, I think over time you notice as a counselor, especially as a clinical mental health counselor too, we are trying to help that person to be more well. We are trying to help them build on their strength. We're trying to tap into the resources that they already have. It's a little bit of a different emphasis, right? But when you treat people with dignity, when you have empathy for them, um, you should really be able to see some of those things already being there. To just focus on the pathology is really a certain mindset. And I wouldn't say that that's necessarily the mindset of counseling. It's a part of it, for a lot of different reasons, but we also really want to focus on those wellness strength aspects. There's also a developmental focus. So, we all take a lifespan and development class. We want to integrate those normal developmental processes and our understanding of how to negotiate life transitions into assessment and treatment. So, we're thinking about those Erickson stages, right? Like intimacy versus isolation, right? So when we're thinking about stuff like that, we're thinking to ourselves, okay, well, like, is this person isolating? Is this person forming intimate relationships with people, close relationships with people? What is the impact of doing one versus the other, right? So even as soon as you hear somebody talking, maybe you see uh, something that is pretty obvious from the standpoint of kind of normal or normative development that this person is missing out on, and it could be a conversation about trying to facilitate that process, right? There's also an ecological focus. Definitely talk about this more in like the theory based chapter, but I would say that you always want to think of the context. I mean, if you think about a kid maybe acting out in school when you're trying to identify all the things about this particular person in front of you, just to find out that their parents are abusing them at home, it's pretty clear that the context the person's in might be influencing the behavior, right? So I mean, if they're getting hit before school, if they're in fight or flight, they've also just been learning these kind of mechanisms to cope with problems. That'll be a relevant part of the treatment, because even if we treat the client and they're better and they go home and they just get re-traumatized, um, we would think that that's probably influencing the behavior. Then the focus of treatment, like we kind of been talking about, where we talk about mental health and wellness, and we do talk about mental illness slash psychopathology. So those are the focus of treatment at times, right? We definitely want to work on mental illness when it's there, and the client and the different levels of context that we're given. is kind of goes back to that ecological focus. Like we might be working in a particular context, maybe having to advocate for the client or something like that could be the focus of treatment. As far as the approaches, there's those remedial and wellness interventions, right? Sometimes we have to intervene to try and fix a problem, to try to manage a problem. And then also, like some of those wellness interventions, we're trying to strengthen our body against some of these things or just promote like optimal performance. So these are just general themes and definitions that came out of the 2020 vision. They also definitely apply to clinical mental health counseling as well. So let's be a little bit more. Let's kind of add to that definition of clinical mental health counseling. Clinical mental health counseling is the specialization of counseling that applies wellness and remedial approaches to the assessment and treatment of individuals and their related systems within relevant ecological contexts. So, like we said, I think when we talk about the wellness and the remedial approaches, we're different from some of the other specialties. Like, for example, school counseling is going to be more focused on delivering these interventions to help academic goals. So you don't really see that here. We're more focused on the wellness and the remedial approaches for that, like pathology in the community, in different agency settings, in outpatient and private practice. So you don't see here certain other things that you might see with a different specialty, such as school counseling, for example. So when it comes to this general discussion, like why would you refer a friend to a clinical mental health counselor specifically rather than a psychologist, psychiatrist, social worker, or marriage and family therapist? And similarly, I think you could kind of answer these together. What distinguishes clinical mental health counselors? I would say that if you go back to what we were saying before, right, I would want to refer a friend to a clinical mental health counselor if they were maybe going through a struggle that seemed to be maybe a normal part of a developmental transition, and they were struggling to cope with it. Maybe they weren't really using their strengths, their resources that they have now. And maybe it also, I'm trying to give the certainty to specify here. Maybe we're also sure that they don't need medication. Maybe also the other thing that they don't need is necessarily a resource. Maybe they're fine financially, right? So, I'm trying to go back and touch on some of these things because it's like, well, maybe they don't need a psychiatrist. Maybe they don't need a social worker specifically. They're not really interested in getting their IQ tested. They already had that done when they were a kid. So maybe they're not going to a psychologist. It's really an individual problem. So it's not so much a marriage and family therapy issue. It seems at that point like a clinical mental health counselor would be perfect, And it surely, I'm not saying that you have to go through that checklist every time, right? It's more so that this just helps you understand where we come in. Like, I think that person could come to the counselor feeling 100% adequate that they've chosen the right person, because that's where, even though we all have those commonalities, if the person knows the clinical mental health counseling identity, that's going to be it. Somebody that helps with transitions, somebody that's going to be able to help emphasize wellness and those strengths and things like that. Also, somebody that can provide a remedial approach, that can try to adjust, manage, assist an existing mental health condition. So I think that's the other thing too, right? Even if they do have some psychopathology, it would still be a wise choice to come to a counselor because we can treat those types of disorders. So, like I said, the other specialties within counseling, there's addiction counseling, there's career counseling, student development, college counseling, gerontological counseling. That's like counseling older individuals, right? And a lot of the different concerns that come along with getting older, such as grief and loss, changing roles, things like that. Couple and family counseling, counselor education, which is what I'm a part of now, almost finishing up my PhD here. There are also conferences that relate just to counselor education, for example, rehabilitation counseling, and school counseling. So these are all different professions within counseling, and it's important to know those, right? I mean, those have very different emphasis, and to a degree, we take different courses. So that's why we're talking about all this stuff. When you're talking to a school counselor, maybe versus a rehabilitation counselor, who, if I didn't say, is helping individuals with maybe physical or emotional disabilities, reintegrate into their environments and their communities, you may not know the scope of some of the classes that they had to take, right? So, and at the end of the day, why we can all become licensed professionals is because we have different core classes, and we're going to talk about that over time as far as some of those specifics about what courses are involved with licensure and things like that in different chapters. I want to say chapter 5 or 6, we talk about licensure. So yeah, just putting those different specialties on your radar. The 4 relevant professional organizations that have really contributed to this identity of a clinical mental health counselor is the American Counseling Association, American Mental Health Counselors Association, the National Board of Certified Counselors, and the Council for the Accreditation of Counseling and Related Educational Programs. So when it comes to the ACA, we had talked about them because they were very involved in that 2020 vision back in 2005. They represent the interests of professional counselors in general, right? So that's their job. And they were founded in 1952, nearly 56,000 members. This book's a little bit older. I apologize because I probably could have looked up a more recent number, but at least we know that that's probably what it is at least. And then it was formed through the alliance of the National Vocational Guidance Association, American College Personnel Association, National Association of Guidance Supervisors, and Student Personnel Association for Teacher Education. What I want to point out about that's not on the slide is these smaller groups basically represent the specializations of career counseling, student development, counselor education and supervision, and teacher education, which form the original divisions of this association. So the reason I like talking about that is, once again, keeping in mind that there were different pockets coming up, and I think you're going to get the history of that at various points throughout this course and other courses. But when you think about that, we kind of came out of, again, career counseling, student development, counselor education and supervision, and also general like teacher education to a degree, insofar as school counselors were also tied into teaching at one point. That's also an interesting thing that you might not think about. So all of these really influenced our identity and our organizations that work together to define what counseling is. It's not really so much a surprise that these different specialties are kind of under one roof, because once again, they had joined together to form associations like this that are now still prominent in influencing the field. I'm not going to go through and read all these 20 divisions of the ACA, but just know, if I didn't say it on this last slide, there's at least 20 divisions, and there could be more at this point as well. So I'm trying to do a better job of supplementing some of that information, guys. But once again, it's not super critical. The point is just that there are so many different divisions. When you think about it, there's a lot of good reasons why you want these divisions. They advocate for certain like reimbursement and stuff like that. They can help to advocate for their special to be looked at as legitimate. They may also hold kind of educational like webinars and stuff like that. You also just have like a community network of professionals that are in your niche, right? So it's really important to have these different divisions for that reason. And then the American Mental Health Counselors Association, the AMHCA, they represent the interests of clinical mental health counselors specifically. So our specialty is something that they're working on. And then this was founded in 1976, became a division of ACA in 1978, and it does operate autonomously with separate finances, but collaborates with ACA on issues of common or intersecting interests. So, once again, we do have that association that really represents our interests as well. Now, when it comes to the National Board of Certified Counselors, the NBCC, they certify professionals who meet standards to qualify as certified counselors or specialists. Now, one thing that can get a little confusing about this, I put the words voluntary and non-statutory. If you look in your book, basically this credential is voluntary, and the non-statutory part means that basically it doesn't really have anything to do with the law. It doesn't have any legislative power, but having this credential is basically shows that you've met certain standards. It's not required, because there are other things that from the law standpoint are more important. But I'm not trying to be confusing here. What happens is, when you go to become a licensed professional counselor, you do need to take the NCE. When you pass the NCE, you are eligible to be a nationally certified counselor, which is an NCC. Here they have certified clinical mental health counselors, CMHC. Um, like in our state, for example, I know that we do the nationally certified counselor. Um, so basically, what I'm trying to say is you finish the exam, you can get the credential, but it's optional. If you don't have it, as long as you pass the exam, you can still go on to get your LPC. So a lot of people get the NCC when they pass the exam anyway. They're like, okay, well, I'm a nationally certified counselor. I guess now let me just make sure that I get that credential. But some people opt to maintain their credential or not. Me personally, I do like to maintain it. I also think, once again, the MBCC offers different things. I mean, they offer grants, they offer scholarships. I'm going to say, and we're going to talk about it here just at the end briefly, being involved in professional organizations can be really helpful. So, try to start looking into that. Try to look into like what does the National Board of Certified Counselors do? And if I see anything relevant, I'll also talk about it. But just letting you know that even though this isn't maybe required, that there could be some benefits to being a part of the organization and learning from it. And yeah, so they for example, they have these specialty type of certificates in clinical mental health, school counseling, and also like master addictions counselor. But for the most part, and there might be some times where those certificates are required for other particular jobs and things like that. But I'll say in general, in PA to become the LPC, it's not as critical. The NCE definitely is, which you'll learn more about in the program. And then as far as CACREP, the Council for the Accreditation of Counseling and Related Educational Programs, they seek to maintain excellence in academic training standards. If you actually look on the CACREP document, you're going to see information about the learning environment, professional counseling identity, professional practice, evaluation in the program, entry-level specialty areas, doctoral standards for counselor education and supervision. I do encourage you guys to look that up. And over time, maybe these will be some activities and stuff that I include in the course. Even just things to look through, not just trying to force your hand on it, but take a look at those things because, once again, this is all going to help influence your professional identity development, to literally go through the document that says, what are our overarching organizations telling us is important for our growth, So it was created in 1981. It's an independent accrediting body recognized by the Council for Higher Education Accreditation, who's responsible for a lot of different accreditation. And then the big thing here is graduates from CACREP approved programs have an advantage when applying for professional licensure. I remember when I got my LPC, I think it took, I want to say like 3 weeks or less. I mean, it might have even been a week. I can't actually even remember, but it was very quick. And I attribute that to having a CACREP accredited master's degree, maybe to a degree, even the doctoral program, maybe seeing some of my credits from there, or also from an accredited program, I think adds some validity. The fact that you guys are in a CACREP program, no one's really going to question, oh, well, maybe we need to see the syllabi for those courses, or, trying to speculate and audit other aspects, because, being accredited by CACREP is a pretty good stamp in and of itself. As far as professional identity development, this is the last thing that we want to touch on, because we've really been talking about from the beginning, what is the identity of a clinical mental health counselor. And even though we've talked here about like definitions, we've compared ourselves to other professions, we've kind of asked ourselves like, why do you want to go to a clinical mental health counselor as opposed to some of those other professions? And that might have provided some insight. But let's also say that there are models of this professional identity development when you as a counselor might recognize that you are growing, right? So the self as a professional counselor identity emerges through feedback from clients, supervisors, and the professional community. So once again, just as a general point, when you're in your program and you're hearing some stuff about yourself and you're like, oh my God, yeah, I did paraphrase, I did use this counseling skill, right? And you start to learn about yourself, your counselor identity is going to build that way in a global sense, right? Then there are also these specific developmental models. So one model that's in the book is a 6-stage developmental model. That anticipatory stage, you start meeting clients, right? Makes sense. That's like the first thing out the gate. Then also there's a dependency stage. You're still really relying on your supervisor for answers. Maybe you're even hoping for the perfect answer sometimes, right? Stage 3 really has to do with still relying on the supervisor, but maybe for the first time you're starting to move towards a little bit of independent activity. You're starting to take some of that initiative to maybe learn an intervention and apply it. Now, stage 4, you start to really get excited. You start to really identify with that autonomy more, right? Maybe things are really working out. You're happy to be trying new things. You're confident that it's okay. Stage 5, that identity development is really strong. So now that autonomy is not something that's budding, it's really a part of your identity. You're like, I am a counselor. I do this. I have an idea even when something comes up that I'm not sure of. And that's not to say that you don't still consult, but if it's going to feel a little bit more like consulting versus just being taught, so to speak. And then the last one is, you're settled into the profession, you exhibit calmness and collegiality, right? So once again, at this point, you're very calm, and the way you talk about it is just a typical counselor who has some experience, has some ideas. Hey, if that's not working, I would try this. Rather than just seeking the answer from a supervisor, you're going to have a lot more input, for that conversation. And then the very last one, I like this because I resonate so much with this. Another model that professional identity development is kind of described through is 3 transformational tasks, right? The first task is the trainees move from definitions that reflect external input to internalized definitions. So, here it was, I just talked to you a lot about the definition of counseling and the professional identity. But I wonder over time what you're going to think of it, what you're going to make of it, what you think counseling is all about and where we need to go. And clinical mental health counseling specifically, as maybe you learn about other specializations. Like, do you think we should incorporate things from them? Do you think we need to do stuff even more different from other specialties, right? So that internalized definition is going to be prominent in your growth. You're going to see yourself learning to define things. And that's not to say that you completely get away from textbook knowledge, right? I mean, you're not developing your own profession necessarily, but you are having a more experiential understanding of what you need to do. And then in the second task, right, you shift from external scaffolding to assuming personal responsibility for one's professional development. So once again, at this point, I can say for myself, even getting out of the program, putting in a couple years, one of the questions that you start to ask yourself is like, where do I need to get additional training from? It's not always clear that, every skill that you wanted to develop is going to be done. There's more that you want to learn. You realize you're like, oh, maybe I want to do EMDR. Maybe I need to learn more motivational interviewing. Maybe I need to learn more about Gestalt therapy. Like, there's so many different things. And it's not just that I'm going to enter the program and it's going to teach me everything. It's what can I do to start learning now? Maybe I need to read some different books that I've never read. Maybe I need to go to some training, in-person training opportunities. Maybe I need to do an online webinar. So, at that point, I'd say you're really accomplishing that second task. In the third task, you kind of move away from just, focusing on your license type or your job title to understanding your identity within the professional community and associations. So I think it's like saying, becoming a part of something larger than yourself. Once again, just trying to connect it to personal experience, which I encourage you guys to do. The first time I ever went to a conference, it really blew my mind because I remember the first lection or session, sometimes it's called, that I walked into. It was 3 people that had written a textbook that was my sexuality counseling textbook in my master's program. And I was blown away to think that that's how powerful this organization was, that you would and this conference was, that you would meet people like that just bumming around, right? Like, I just randomly picked a session that was relevant to some of the stuff that I was studying. I was doing some research that had to do with addictions, career counseling, and sexuality counseling. And so going in there, to think that was the authors of a textbook that I'd actually cited in the research, that gave me the opportunity to ask them questions, to learn from them. And so I started to really see, okay, yeah, I want to be a part of these things and I want to learn from them, and they have so much to offer. And, in that moment, you become a part of that. You get to be a part of that process. So, that's that third task, right? At that point, you're basically, you're guiding the profession, right? You're coming up with definitions. you're taking responsibility for growth, and maybe even able to convey that to other counselors now. And then you're a part of the profession, and you're learning from it and interacting with it. So, that's basically the end for today. And just kind of reflecting over what we talked about then, the identity of this clinical mental health counselor falls in line with counseling generally speaking, insofar as we treat individuals, families, groups, etc. We work with their mental health. But a clinical mental health counselor also really deeply focuses on those wellness aspects, those strength aspects, and like I said, we're working with developmental transitions. We're not necessarily providing medication. We're not all the time, connecting with resources. And once again, we certainly do provide resources. We just might not be as intimately involved with those resources. So, if you have somebody struggling with their mental health, with a transition, it would very much be appropriate to come to a clinical mental health counselor who is using both of those ideas in the conceptualization.